This is Modern Dental Assisting, Chapter 44, Dental Liners, Bases, and Bonding Systems. In this chapter, we cover the dental materials that are supplemental when we're doing restorative work. This is going to include our liners, bases, varnishes, and bonding systems. So we first talk about the prepared tooth structure, the design of the cavity preparation. This is going to provide strength within the tooth and help determine how the tooth will hold the restoration in place. The prep is going to look a little bit different, varying from amalgam to composite, with amalgam having retentive grooves to mechanically hold the restoration in place. So we talk a little bit about the pulp being the most inner part of the tooth that houses the nerve and the blood supply, keeping the tooth alive, and the responses to stimuli. So we have the physical stimuli. This is a response to thermal or electrical, mechanical. So this is going to include trauma to the tooth from the hand piece or possibly biting and chewing forces, chemical stimuli from dental materials or acid in dental materials, and then biologic stimuli from bacteria and saliva. We'll first talk about cavity liners. This is a thin layer of material that's placed at the deepest portion of the dental preparation. This is used to protect the pulp from irritation caused by the stimuli that were talked about in the last slide. The health and condition of the tooth being restored determine what lining agent the dentist will select from calcium hydroxide or glass ionomer. Varnish is a liquid consisting of one or more resins in an organic solvent. This is going to be placed within the entire preparation. And what this is going to help to do is seal the dental tubules. This will help in reducing micro leakage around the restoration and then also act as a barrier to protect the tooth from highly acidic cements like zinc phosphate. Remember, with varnish, we don't want to use this with composite. So typically you're going to see this in your amalgam procedures. We're going to apply this with a small disposable applicator or a cotton pellet. And it's important to note that if we're placing a liner, we're going to place the varnish after the liner is applied. Fluoride varnish is a gel-like substance designed to release fluoride on the enamel, root structure, and dentin structure. Specific indications would be as a professional topical fluoride application like you would get after your prophy cleaning, treatment of hypersensitive cervical areas. So when we have some gum recession, our orthodontic patients, it's always helpful to have an extra boost of fluoride as a cavity varnish or a dentin sealant. Desensitizers used to treat or prevent hypersensitivity that a patient may experience from a newly placed direct or indirect restoration. This can also be labeled as a primer. It's designed to seal the dental tubules. No surface layer of the preparation is prepared when a desensitizer is used, and this is ideal under all indirect restorations. One of the popular desensitizers you may see is labeled as HEMA. We're going to use this sparingly, and we don't want this material to contact any of the soft tissue within the oral cavity. Next, we speak on dental bases. So when a tooth preparation becomes moderately deep or deep, referring to the pulp, the dentist may place a base under a permanent restoration. This is going to be like an additional layer to protect the pulp from those stimuli that we spoke about earlier. So the base is going to provide a different types of pulpal protection, ranging from just protecting from a large restoration, from thermal shock, and then they may also have a sedative effect soothing the pulp that has already been damaged by decay or irritated by mechanical means with the handpiece. Types of base materials may include ZOE, zinc phosphate, polycarboxylate, and glass ionomer. The base is supplied in a putty-like consistency because it actually provides a buffer or layer between the pulp, and we typically apply this at the base of the preparation in a thickness of 1 to 2 millimeters. Next, we talk about dental etchant. Before bonding, the tooth surface will need to be etched with an acidic tooth conditioner. This is critical for both enamel and the dentin surfaces. This is the application of phosphoric acid solution, and that's going to remove the smear layer, and also it creates a mechanical effect with the bond. This is supplied either as a liquid or a gel, the gel being packaged in a syringe type applicator. We'll place this on the tooth for 15 to 20 seconds. And this is where we'll rinse the tooth thoroughly and air dry. Remember, at this point, if the tooth becomes contaminated, we will need to re-etch. Bonding is also known as dental adhesion. This is the process of solid and or liquid contact of one material with another. It has retaining properties, and a primer is applied after etching and before bonding. When sealant, resin, cement, or restorative material is placed on an etched surface, it flows in and around the enamel tags, and this creates that mechanical seal. Dentin consists of organic substances. Bonding of restorative dental materials can be difficult. Major factor in success of bonding material to dentin is removal of that smear layer with the etch. Remember that a slight amount of moisture must be maintained on dentin. If dentin is completely dried, the tooth structure could be harmed. Bond is available as self-curing, dual-cured, and light-cured. This can be a single application or a mixture of 2 liquids. Each bonding system is different, so it's important to look at the manufacturer's instructions. The tooth surface receives a etchant material, which is going to remove that smear layer and create those tags. Bonding component is allowed to flow into the small defects and into the partially open tubes. And then the material is allowed to either harden or act as a hybrid layer or remain in a liquid state while the restoration is being placed. Guidelines for clinical application of bonding products. Be precise in performing bonding steps. Avoid expired, thickened, or contaminated materials. We want to make sure that we're removing any plaque or debris before beginning. You want to avoid over drying or desiccating the tooth. Ensure that bond solution covers all surfaces. Avoid contamination. Remember, if the tooth is contaminated with saliva, we would need to start over with the etch process. And allow as much time as possible for the bond to mature.